Hi, I'm Natalie Aquino.
Hi, I'm Andrew Delani.
Hi, I'm Mark Q. We are student pharmacists at UCSF taking on the Script Your Future Challenge.
To bring awareness about the importance of medication adherence.
Not only as student pharmacists,
but in general as healthcare professionals.
But like for some of you, some of us are still trying to understand what exactly is the issue with medication adherence and what are some of the ways we can improve it.
And how can all healthcare professionals take part in advocating medication adherence?
So today, come follow us as we find out what is the deal with medication adherence and why it is important.
What is medication adherence?
I believe that medication adherence is the ability for a patient to follow a prescribed drug plan according to what their physician has told them.
Yeah, medication adherence is when the patient continues taking their medication as prescribed.
So that could mean taking it to its full course, taking it at the right time, and taking it properly. So there are many different facets.
First, the ability of patients to be able to take their prescribed medications. But I think it goes deeper than that. I think it has to do a lot with patient education, patient understanding, and their ability, both from an intellectual standpoint as well as a socioeconomic standpoint, to be able to take the medications that they're prescribed.
Medication adherence is when a patient is able to follow a prescribed course of medication. And it's a good thing because ultimately it leads to better outcomes in terms of healthcare management.
So medication adherence is really important, not only because it really maximizes the drug's ability to help the patient in whatever they need help with, but it's also very empowering because if a patient is following medications and know when to take it and what the side effects are if they don't take it correctly, I think it's empowering for them to know their own disease states and what they're doing is actually helping them.
Why is it important?
Medication adherence is particularly important for chronic diseases. We have chronic diseases like high blood pressure, diabetes, high cholesterol. I could go on and on about the different chronic diseases there are. But these are diseases that require patients to take medicines essentially over their lifetime. And so within a lifetime, I think there are a lot of opportunities to decide that you're not going to take your medicines because you feel well, because you can't afford the medicines. Many things can go wrong when we expect a patient to take the medication for the rest of their lives. So this is why medication adherence is important for diseases, for long-term diseases that require control from medicines. At the same time, I don't want to leave out the importance of medication adherence for even short-term diseases. We have a huge problem with antibiotic resistance right now, and a lot of that resistance has been garnered by people not completing their antibiotic therapies and breeding resistant antimicrobials. So even adherence to a short-term therapy can also be important and have important consequences for a person's health.
Particularly in the field of dentistry, I believe that oral hygiene habits are more so important. We tell patients, we give patients instructions like with each visit, even like before they come, after they come, constantly reminding them to, the two basic things like everyone does when they wake up and go to sleep is, brush your teeth and floss properly. Brushing your teeth, obviously, people take those things for granted when in reality, there's actually certain specific ways to, brush and floss, and patients don't necessarily understand how to do that. So it's up to us to be like the mentor or the guider to really teach them and educate them how to brush and floss properly. And something simple as using fluoride in their toothpaste, using fluoride in their mouthwash, something like that can prevent caries. And it's mainly on us to depict that to our patients.
In terms of diabetes, we see three core pillars. One is medication management, second is lifestyle, which includes physical activity, and diet. So I'd say these three are core pillars. Many patients will need some form of medication therapy. And essentially diabetes was a disease that literally killed most people who had diabetes. But because of the medications, it's a technological advancement. Patients are now able to live functional lives in addition to having a full life thanks to the medications. And essentially, the medications help the patients gain better control of their diabetes. In short, we're talking about the sugar management. But within diabetes, there's also the blood pressure management, the dyslipidemia, in addition to a whole host of other conditions. So when a patient has diabetes that takes medicines, they're not only on one medicine, they're on 5, if not 10 types of different medicines. And the issue of medication adherence becomes more important in that case. Because if you imagine yourself taking one medicine for the rest of your life, it's a challenge already. Now stack on top of that multiple medicines, different times of the day, and you're thinking about lifelong. That's a challenge. But this is what most, if not all, diabetes patients will have to deal with. And as pharmacists, we can help them understand the medicines in addition to how to take them regularly and in ways that might be more efficient.
So for heart failure patients, it's important that they remain compliant and adherent to their medication because that's been shown to decrease their readmission into the hospital after their heart failure exacerbation. And for those patients, oftentimes they go home on a complex medication regimen consisting of their loop diuretic and their beta blocker and their ACE. And sometimes they don't necessarily understand their disease state. They don't understand why this is happening to them, and so they don't necessarily understand why the medication is important.
Medication adherence.
So there's some practical ones. For instance, financial concerns. A patient may not be able to afford the medication prescribed by a physician. Lack of understanding of how to take it or its importance. I think one of the bigger problems is they don't understand that it's a preventative measure in many cases. So though you may not be able to feel the day-to-day consequences of having something like high blood pressure or high cholesterol, down the line you're definitely going to experience those problems. Also, perhaps they may not understand exactly why they're taking it or what they're taking. I can imagine a lot of instances in which a patient, like specifically an older patient, may be on a very regimen of prescriptions that have many different uses and applications, and they may not know why they're taking the blue pill or the yellow pill. And my grandparents are certainly fall into that category, and I can understand confusion.
Another thing is it's more of a lifestyle change. When they take medications, it's something new. Some of them don't like taking meds, they don't like the taste, or they don't like just carrying it around with them.
Some of the barriers to adherence may lie on us as healthcare providers. The way that we communicate with patients, the support we provide them, the importance that we ascribe to staying on your medicines, the benefits of medicines, as compared to what we're oftentimes giving patients are the risks of taking medicines, may unduly influence how a patient takes their medicines. And then lastly, a lot of things that are really complicated are system-related barriers to adherence. Patients have complex insurance plans. Oftentimes they may be rotating from different plan to different plan, which causes lapses in coverage for medicines that are needed. And so inability to pay, lapse in coverage, different medicines being covered, delays in communication between insurance companies, doctors' offices, and pharmacies. All of these can brew a really crazy stew that can get in the way of a patient taking their medicines faithfully every day.
Potential barriers and understanding sort of cultural barriers in terms of what patients have in mind in terms of what Western medicine and what kinds of medications do. There's certainly a lot of stigma for a lot of people that medications can be very dangerous, and there's certainly I believe a lot of fear amongst many patients that medications can be harmful rather than helpful. So I think having providers take the time to address those issues and answer any questions would be particularly helpful with those sorts of barriers. And I think there's also just logistic barriers as well. For example, taking multiple medications can become confusing for patients, and trying to simplify those sorts of regimens might also be helpful as well.
The pharmacist or healthcare provider barriers include the fact that there's not a lot of education when we're going through school as to how we can approach patients about their adherence and to assess it, and then also the best way to help solve the problem.
There's no standard of medical adherence education in schools of pharmacy. One school can teach more and other schools could not teach them at all. And so there's different levels of education for healthcare providers. And the worst part is that there's not a lot of funding to fund pharmacists to really put in time to do medication, to put in time to improve medication adherence through counseling. And that's coming from pharmacists not having healthcare provider status. MTMs are not reimbursed. And so corporate, a lot of retail corporate on the corporate level, they're not reimbursing pharmacists to really help patients take medication.
Okay, so that is a multifactorial question because depending on the types of patients, for example, we're dealing with patients that have low health literacy. So simply understanding what their medicines are for would be something. So in short, communication. If a person doesn't understand what the medicine is for, there's a good chance they might not be as adherent to it. And in fact, UCSF had a study recently that communication does make a difference between a patient being adherent or not adherent to a medicine. And this comes down to the provider level. So as pharmacists or physicians or other healthcare providers, if you don't have that strong connection, communication with the patient, they might not be as willing to take the medicine.
There are a lot of things that we as healthcare providers can do to ensure that our patients have the best chance of taking their medicines properly. And one of them just starts with asking patients about their adherence. I think that oftentimes healthcare providers are either too busy to ask, which is probably more often the case, or afraid to ask whether or not the patients are taking their medicines. Just because a prescription comes out the door with the patient doesn't mean that they're actually going to take it and put it in their mouth. So asking, I think, offers up the opportunity to learn more about why the patient may or may not be taking their medicines. We may find out information about the bad side effects they're having that cause them to stop their medicines, or the insurance troubles that they're having getting the medicine we prescribed covered for them. So asking the question, I think, is not the final solution, but is definitely the first step.
Emphasizing better communication with the provider, making sure that the patients actually take their medications and are adherent. Oh, I have another one. So we actually had a program during my residency in cardiology where we saw the patients in an outpatient setting right after they were discharged from the hospital. And this was beneficial for them because they were able to come in and we were able to discuss their medications, how they've been doing since the week or two that they've been discharged from the hospital. So that reinforced the notion that they need to be adherent with their medication, and it allowed us to keep track of them in an outpatient setting to prevent readmission.
It's important for us as a dentist to be persistent with the patients and really give an explanation as to why they're doing the little things that they're doing, such as brushing and flossing, because sometimes patients can take it for granted and they don't know why they're flossed twice a day or why they have to brush at a certain angle properly. So it's really important for the dentist to kind of grill those facts into them so they understand. And with that said, patients would be more adherent and have a more open mind to know that if they snack frequently, such as in their diet, if they eat sugary foods, why it's especially important to do the little things like brushing and flossing.
I think the patient needs education, especially those patients who are low education, low income patients. They need more patient education, and the providers need to, drill into them the importance of taking these medications. Second, they need to have support, like family support, because if they themselves forget to take the medicine, then there will be somebody there to tell them that you need to take this medicine at this hour. And probably insurance. I don't know how we can help that, but the patient needs financial resources so that they can buy those medicines.
My point of view, I'll be a physician in the future. I would aim to help the patient understand why they're taking each pill. assess whether or not they're actually going to be able to take it. I can imagine, for instance, you may not necessarily prescribe the best course of medication if the patient is not financially able to actually take that course. And my goal would be to prescribe the best set of medications possible for their concern, given all the constraints possible, and also whether or not they're able to take it as well.
The patient with diabetes, we're dealing with multiple medicines, from multiple medicines to help them with their sugars, to blood pressure, to dyslipidemia, and additional other medicines. So first of all is, let's help them understand why they're taking the medicines, the need. And actually, I'll mention that there are patients that, I'd probably say a good half of patients who ultimately their goal is to come off of the medicines. And as pharmacists and as healthcare providers, we're within the mindset of helping them stay on the medicines, which has a lot of benefit. But then at times I also want to keep in mind of what the patient's goal is. Because if ultimately they're wanting to come off the medicines, then that is a way where we can align with them and potentially work with them on maybe some other factors where they can alter just small little steps within their daily activities or their daily habits, which might make a big impact in their sugar management, which then they can decrease maybe the dose of the medicine or even come off of one of the medicines. They might be on 2 or 3 different types, maybe come down to 2 or 1 of them. So that's one thing I think that we sometimes lose sight of. We're always in a mindset of always be on the medicines, which has a lot of value, but we need to also be mindful of what the patient's goals are. We're ultimately wanting to help the patient prolong their life, improve the quality of life, and avoid these major cardiovascular and microvascular complications. So we're looking at the heart attacks, the strokes, we're looking at the blindness, the kidney failures, the foot amputations, and ultimately quality of life, because if you're at a point where you're having elevated sugars consistently, that contributes to fatigue, that contributes to the inability to function at your more optimal state. And that then leads to this domino effect.
Adherence, again, having a non-judgmental attitude is helpful, and getting to the root cause of what's causing that non-adherence is really important. So the discovery is one thing. Trying to problem solve to ameliorate that non-adherence is another thing. So we'll ask you, well, what was it that caused you to miss your medicines on those days? Let's see if we can think of some solutions. At the end of it all, really, the impression you want to leave with your patients is that you care whether or not they're taking their medicines. And the reason you care whether or not they're taking their medicines is because you firmly believe that the medicines are there to improve their health. If that message comes across, even in a garbled way, and if your adherence counseling is not perfect, if you give across the message that you care and that by checking in on their medicines is a way of showing you care, you've done a decent job.
So after a long day's work, what did we get out of this?
We saw that, regardless of the profession, being aware of the bigger picture, listening and asking questions, educating patients about therapies and their benefits, and modifying their treatments to their specific needs all help to break barriers down between the patient and the healthcare professional to ultimately build trust and a relationship.
Through this relationship, we take patient care towards a more genuine and humanistic approach, which can in fact improve medication adherence and to essentially improve patient outcomes.
We must realize that medication adherence is not the sole responsibility of the patient, but ours as well.
Well, let's step up and bring a change for our patients.
So, we ask you now, what can you do to improve medication adherence to motivate patients to help themselves?